The Affordable Care Act contains a provision that requires all legal U.S. residents to either obtain a health insurance policy or pay a fine. And that's an important mandate because if people aren't required to obtain health insurance, then younger and healthier people might not enroll in a health insurance policy. And that would leave older and sicker people remaining in the risk pool, and overall premiums might increase. The RAND study was trying to look at the effect of eliminating the individual mandate on a number of different outcomes, including health insurance premiums, the number of people who get insurance with and without the mandate, and then the effects for government spending. Many of our findings are similar to what other studies have reported. So, for example, we see a large decline in the number of people newly insured when we eliminate the individual mandate. And we also see that government spending per newly insured individual increases substantially, more than doubles when we eliminate the individual mandate. What's different about our findings is that we look at the effects of premiums in the health insurance exchanges by estimating the change in premium that any given individual would face. In contrast, the other studies have looked at the overall average premium. And as we've discussed, the overall average premium takes into account age composition effects, and so you can get a much larger increase in the average premium than any given individual could expect. So the increase in premiums for any given individual is about 2.4%. Overall, we actually see a larger increase. We see that the average premium on the exchanges rises by about 9.3%. That's driven mainly by an age composition effect. The Affordable Care Act allows insurers to charge older people 3 times as much as they charge younger people. So when we see younger people exiting the market, we're going to see an increase in premiums just because of the age composition shift. But what we see in terms of a change for any given individual is just a 2.4% increase in premiums. Our findings should have implications in the debate over the individual mandate. So first, we find that the number of people newly insured falls pretty substantially if we eliminate the individual mandate, from 27 million to about 15 million. Second, government spending per newly insured individual more than doubles when we eliminate the individual mandate. The reason is that many of the people who remain insured if the mandate is removed are people who are heavily government subsidized. So the government is continuing to spend a lot of money on those individuals, and so the cost per new enrollee more than doubles. In terms of the effects on premiums for individuals who purchase coverage through the exchanges, we see a slight increase, about 2.4%. It's not enough to cause death spiraling or market instability, but it is an out-of-pocket cost that people who are insured are going to have to incur if the individual mandate is eliminated from the law.